Hey everyone, Dr. Shawn Talbott here. We're going to be talking today on Mental Mug about who and what as it refers to probiotic strains. So I got this really interesting question, which is, can you talk about native probiotics compared to transient probiotics? Why are they important, or are they even? And this brings up a really, really important question with probiotic supplementation in general, and we can even lump fermented foods into this discussion. So a lot of times people feel like, and this is very logical to think this, that when you take a probiotic product, there's a bacteria in that product, or sometimes several bacteria in that product, and you swallow it. And if it's formulated the right way, it'll go past your stomach acid, it will go past your small intestine, it'll eventually get into your large intestine, your colon, the lower part of your GI tract, and that where 99% of your gut microbiome resides. And those bacteria will become resident. They'll be the right kinds of bacteria. They'll set up shop, and they'll start happily living there, right? Why else would you take a probiotic supplement except to get those bacteria into your microbiome, where they can start doing all the wonderful things that a microbiome is supposed to do? That's a very logical assumption, but it doesn't always work that way. Sometimes it does. Sometimes we take a supplement and it goes through all that transit, right? It could be dead in the capsule or the powder, and then you may or may not get benefits from it. We'll talk about postbiotics, which are dead bacteria, in just a second, that can have benefits even though they're dead. But let's say it's alive and it's viable, and you swallow it. It could get killed in your stomach acid. There's certain strains that are susceptible to damage and killing in your stomach acid. So, hopefully it's either protected if it needs protecting, or it's a strain that is able to pass through stomach acid without being damaged. It has to get through different kinds of digestive enzymes in the small intestine, where most of your digestion actually happens, and that's where you absorb most of your nutrients and things like that. You want it to get down to the large intestine, which is only slightly acidic, as a different environment, but it's a hostile environment because there's trillions and trillions of other bacteria there that might want to kill this new guy or these new guys that you just supplemented with. So there's a lot of potential. There's a lot of obstacles that your bacteria in your supplement needs to overcome in order to get down there in the first place. So some of them will do all of that. Some percentage of the ones that reach there, the lower part of your GI tract, will become resident. But some of them are what we call transient. They will just go in there, do their thing, and be lost in your stool, in your feces. They don't become resident. They don't stay there. Well, how is that beneficial? Well, the transient ones might be beneficial because they're communicating with the other players in the rest of the microbiome. They might be communicating with your immune system. They might be there for a short period of time, making neurotransmitters like GABA to help us relax, or serotonin to help us with our happiness, or dopamine to help us be more motivated. They might be making anti-inflammatory cytokines to block the inflammatory cytokines that might already be there. So, they could do their job, but then you have to take them again the next day to do the job again, and then the next day to do the job again, because they're not staying there. They're sort of, coming through town and saying, you do this and you do that, and I'll see you tomorrow. Right? So that's the difference between a resident bacteria and a transient bacteria in the gut. And sometimes you don't know, are they going to be resident or are they going to be transient? And you take it, for a month and then you don't have to take it anymore, or do you have to take it every single day? So that's also very strain dependent. I have another video where I talk about different strains, and once you know the strain, you know the benefit, you know the storage conditions, you know how many billions of CFUs, colony forming units, you need to take, everything about it, including, is this going to be a resident or a transient? So it doesn't really matter that, the way the question is asked, it's an important consideration, but it doesn't really matter, is it resident or is it transient? Because if you're dialing in on the strain, you know the set of benefits you're going to get. But once you know the strain, you also know the usage conditions, right? Take it for a month and you're done. For example, if you're trying to repopulate your microbiome after being on a course of antibiotics or something like that. There are very high dose, trillions of bacteria, trillions of CFUs, colony forming units, that you might take, for a month or two to help to repopulate and re-diversify your microbiome, and then you don't take them anymore. There are other ones like some of the neurotransmitter ones are more transient in nature, and you'll want to take those on a regular basis. You might even want to take more when you're more stressed out and less when you're less stressed out, right? So really dial in on what the strain is, and that will give you the information at a little deeper level than just asking, is it a native probiotic, or is it a transient probiotic? Okay, so it's important to know who's there, but it's also important to know what they're doing. Okay, hopefully this was helpful for you. See you next time.